Thank you very much, Madam Chair. Secretary Kennedy, I want to talk to you about your relationship with this committee and this Congress. I want to talk to you about the statements that you made to the chairman of this committee and to members of this committee during your confirmation hearing about vaccines. You didn't tell the truth. I find that to be really dangerous for our relationship. If I were the chairman who believes in vaccines and voted for you because he believed what you said about supporting vaccines, my head would be exploding. In the hearing, you told us, quote, "I will not work to impound, divert, or otherwise reduce any funding appropriated by Congress for the purpose of vaccination programs." That's not the truth. You've done exactly. Let me finish my question.
Yeah, I didn't hear what you said. I'm just asking you to repeat it so I can understand your question.
During the hearing, I'll repeat it. During the hearing, you said to this committee and to the Finance Committee, "I will not work to impound, divert, or otherwise reduce funding appropriated by Congress for the purpose of vaccination programs." That is not what happened. You've done the opposite. You canceled $12 billion in grants to the states, including my state, that are used to administer and track vaccines. You promised Chairman Cassidy.
When did I do that?
Madam Chair, would you allow me to finish my question?
Keep going with your question.
When did I do that?
Let me finish my question.
Accusation. Just tell me when I did it so I can understand what the question is.
You have canceled $12 billion in public health grants to states, whether you know this or not. That funding is used by the states in part to be able to administer and dispense information about vaccines. Mr. Secretary, let me give you the full panoply of
accusations,
the things you said before this committee that didn't turn out to be true. You also promised Chairman Cassidy that the FDA would not change vaccine standards from, quote, historical norms. But what happened as soon as you were sworn in? You announced new standards for vaccine approvals that you proudly referred to in your own press release as a radical departure from current practice. And experts say that that departure will delay approvals. You also said, specific to the measles vaccine, that you support the measles vaccine. But you have consistently been undermining the measles vaccine. You told the public that the vaccine wanes very quickly. You went on the Dr. Phil show and said that the measles vaccine was never fully tested for safety. You said there's fetal debris in the measles vaccine. And this morning—
All true.
This morning in
Do
front of—
you want me to lie to the public?
That's not— none of that is—
Of course it's true. Of course it's true, Senator. Senator, begging your progress, you do not know what you're talking about.
For the record—
Let's have a little bit of order so that you can get
Madam
your
Chair,
question and we can get
I didn't ask for a response yet.
I
I'd
understand
like
that.
to lay out the predicate of my question before I'm interrupted by the witness. He should
Go
have some
ahead.
respect for this committee.
Go ahead.
Just this morning in front of the House of Representatives, you also said that you, in fact, would not recommend that kids get vaccinated for measles. You said you would just lay out the pros and cons. Okay, so this is the summation of everything that you have said to compromise people's faith in the measles vaccine in particular is contrary to what you said before this committee. You said you support the measles vaccine, but then you have laid out a set of facts that are contested, and I will submit information for the record from experts who contest what you have said about the vaccine, and the result is to undermine faith in the vaccine. It's kind of like saying, listen, I think you should swim in that lake, but you know, the lake is probably toxic and there's probably a ton of snakes and alligators in that lake, but I think you should swim in it. Nobody's going to swim in that lake if that's what you say. And so I want you to acknowledge that when you say you support the measles vaccine and then go out and repeatedly undermine the vaccine with information that is contested by public health experts, that is not supporting the vaccine. And so I guess I have two simple questions for you. One is, can you clarify what you said in the House this morning? Are you or are you not recommending that families get their children vaccinated, or are you just giving people the pros and cons? And do you understand that when you say these things about the measles vaccine, what ends up happening is less people get the vaccine? That may be what you want, but do you understand that the result of constantly questioning the efficacy or safety of the vaccine results in less people getting the vaccine? So I don't necessarily want to spend the remaining 20 seconds in an argument over the science, but do you at least understand that that's the consequence of what you're saying? And are you actually still recommending people get the vaccine, or are you not?
Senator, if I advised you to swim in a lake that I knew there to be alligators in, wouldn't you want me to tell you there were alligators in it?
So are you recommending the measles vaccine or not?
What I've said and what I said in.
Doesn't sound like you are, if that's.
Are you going to let me answer? Are you going to keep interrupting?
Are you not?
Are you going to let me answer? What I pledged before this committee during my confirmation is that I would tell the truth, that I would have radical transparency. I'm going to tell the truth about everything we know and we don't know about vaccines.
Are you recommending the measles vaccine or not?
I am not going to just tell people everything is safe and effective if I know that there's issues. I need to respect people's intelligence.
I think you're answering the question. I think you're
And the
answering the
reason
question. That's
that people-
really dangerous for the American public and for families.
The reason people have lost faith in this program is because they've been lied to by public officials for year after year after year.
No longer recommending the measles vaccine.
Senator Marshall.
The ranking member, Mr. Lauro.
Thank you very much, Mr. Chairman. Let me just one area of correction, which has to do with the measles issue, Mr. Secretary. You keep comparing the U.S. to other countries. You compare us to Europe, but the Europe you are referring to is the WHO European region. That's 53 countries in Europe and in Asia, including those with low vaccination rates like Romania, that has never eliminated measles. If you compare us to Western Europe countries that we often compare ourselves to, like Great Britain, they have seen no measles death this year. Let me move to the NIH. In your testimony, you say you want to quote, and I quote, rescale our biomedical research budget, unquote. Excuse me, but that's BS. You are not rescaling NIH research. You are proposing to cut it by $20 billion. And according to our colleagues in the Senate, NIH has effectively cut research funding by $2.7 billion this year in comparison to the same period last year. That's a cut of 35% during that period. That includes cutting cancer research by 31%. This is the report put out by the Senate, Trump's War on Science, which goes into detail about how we are, in fact, dealing with cutting scientific research. Mr. Secretary, are you freezing or withholding funding that Congress appropriated in 2025 for life-saving NIH research?
Let me address your first issue first, because I want to correct you. We have about 1,100 measles cases in this country. The growth rate last year was 15 additional, so we have plateaued. Mexico has roughly the same number with a third of our population, and they got 300 extra cases last week. Canada has more measles, 1,500. They have 1/8 of our population. Western Europe has about 6,000, which is 10 times the number that we have. Well, you are wrong about what you said earlier.
We can discuss that, but I think one has to consider whether or not we're dealing with decades of data proving how effective and safe the measles vaccine is. I want to move to that. I want my questions answered on, are you freezing and withholding funding that Congress appropriated in 2025 for life-saving NIH research?
We are not withholding any funding for life-saving research.
Okay. Do you commit to following the law?
Of course.
Fully obligating funding that Congress appropriated. We appropriated, it is the law of the land for NIH research, and to obligate those funds by September 30th of this year. Or are you planning to break the law by impounding congressionally appropriated funds?
If you appropriate me the funds, I'm going to spend them.
We have. In the bill, you are cutting the NIH by $18 billion, or you're proposing to cut it by $20 billion. The Congress appropriated those funds. It passed into law. It's part of the 2024 budget, and we are under a continuing resolution that has adopted the 2024 numbers. How then can you justify cutting $20 billion from the biomedical research budget?
If you appropriate the money to me, I'm going to spend that.
We have appropriated, Mr. Secretary.
Then I'm going to spend it.
Then you're going to spend it. You're not going to cut $20 billion from the NIH.
The White House proposal is to do very, very large cuts at NIH.
Well, that is contrary to the money appropriated.
Ranking member.
Yes.
If Congress appropriates me the money, I'm going to spend the money. You have the power of the purse here.
Thank
sure
you.
know that.
Thank you for reiterating that, but I think that I'm not sure the administration really has internalized that, particularly Mr. Vogt hasn't internalized that when he says that we can in fact impound money. The
these are-
money is there. The 2024 budget includes the funding for the NIH. Will you commit to spending the money that is in 2024 in that budget?
As I said, ranking member, if you appropriate the money, I'm going to spend that money.
The money has been appropriated. So the answer to that is if you're not willing to accept the funds that have been lawfully voted by members of the House and Senate on the money for the National Institutes of Health. Well, I'm going to hold you to your word that that funding is there. It should be transferred from 24 to 25, and you've cut already $20 billion. Let's get that money back. Let's get that money back. You have an obligation to carry out the law and to implement what the Congress has done. Unbelievable. Unbelievable. Chronic disease and tobacco. Tobacco use is a major contributor to chronic disease and is a leading preventable cause of death in our nation. Each year, killing nearly 500,000 Americans, costing the nation nearly $250 billion in healthcare costs. CDC's tips from former smokers' media campaign alone is estimated to have saved more than $7 billion in healthcare costs by helping more than 1 million smokers quit. Why did you eliminate CDC's Office of Smoking and Health, an office that reduces the number of kids using tobacco products, helps order tobacco users to quit, and saves taxpayers dollars?
We have, under the reorganization, and I'm going to talk very, very broadly, because as of 4 o'clock yesterday afternoon, we are under a court order not to do any further planning on the reorganization. And I've been advised by my attorneys and not to talk about it. But I will just say broadly, many of the programs that the Democrats are now saying were cut at CDC were not cut at all. Those programs were transferred to the Administration for Healthy America. But I'm not permitted to talk in any more detail because of a court order.
I know we're just dealing with words. You transfer it here, there's less money overall for the agency, therefore there's less money for the programs. In both 2024, 2025, Congress, again, power of the purse resides here, appropriated $246 million for CDC's tobacco prevention programs. Do you commit to following the law again, fully obligating those funds so that we can help adults who want to quit using tobacco and prevent teens from becoming addicted?
Allow me to answer that by pointing out the absolute cataclysmic disorganization of this agency under your oversight for 40 years. We had 9 separate offices of women's health. When we consolidate them, the Democrats say we're eliminating them. We're not. We're still appropriating the $3.7 billion, but we're not keeping all 9. We had 8 separate offices for minority health. We eliminated 1. We had 27 HIV offices.
Okay, let me just, I'm going to
We had
interrupt.
59
The
behavioral
chair is
health
right.
programs.
I'm well over time. If you could just get us what has been eliminated, why you're doing it, and the criteria by which the elimination has occurred. That is information that this committee needs in order to be able to do our job in terms of appropriating funds. Thank you
And
for
we
your
will
indulgence.
gladly provide that to you, but right now we're under a court order that prohibits us from doing so.
Okay, before we go